The broadcast is now starting. All attendees are in listen-only mode.
Welcome and thank you for joining this webinar on ICD-10 Transition, Prospects, and Risks. My name is Kash and I work as a Meaningful Use Coach here in MTBC. With me I have Obaid. He is one of the best business analysts working in MTBC. He will be telling us more about ICD-10 during this webinar. Before we get started, let me first of all tell you about webinar logistics. All attendees are joined in listen-only mode. This means that to ask a question or to make a comment, please tap it in the questions option of webinar panel that you can see on your screen. At the end of this webinar, we will have a questions and answer session, and we will try to answer as many questions as we can. But if we get short of time, you will be reached via email. Let me also tell you a bit about MTBC. MTBC was established in 1999 and is currently serving 35 unique specialties in 39 states across the country. We now have more than 1,000 employees and we are running 24/7 operations. We are ranked among the Deloitte Tech Fast 500 and we are an Inc. 500 5,000 company. We're also Microsoft certified code partners and we provide ONC certified EHR and SureScript certified solutions. If we talk about today's discussion, we'll be talking about ICD-10, what ICD-10 is, its implications and reasons. We will also tell why ICD-10 is better than the previous versions. We will tell the effect of ICD-10 on reimbursements. Also, what providers need to be doing, the important dates and timelines, and finally, MTBC's strategy for a smooth conversion from ICD-9 to ICD-10. So let's get started with ICD-10 overview. ICD-10 is the 10th revision of International Classification of Diseases, where ICD is a medical classification that provides codes to classify diseases, signs and symptoms, abnormal findings, and external causes of injury or disease. Under this system, every health condition can be assigned a unique category and is given a code. Here comes in mind why ICD-10. Now, if we talk about ICD-9, it does not provide the necessary details for patients, medical conditions, or the procedures and services performed on hospitalized patients. ICD-9 is 32 years old, has outdated terminology, uses outdated codes that produce inaccurate and limited data, and is inconsistent with current medical practice. It also cannot accurately describe the diagnosis and inpatient procedures of care delivered in the 21st century. Here, if we talk about ICD-10, it consists of two parts. The first one is ICD-10 Clinical Modification for Diagnosis Coding and ICD-10 Procedure Coding System for Inpatient Procedures Coding. Also, if you talk about the deadline for the United States to begin using Clinical Modification ICD-10 for Diagnosis Coding and Procedure Coding System ICD-10 for Inpatient Hospital Procedures Coding is October 1st, 2014. It means that the providers cannot wait any longer and that they also will be facing a lot of challenges for healthcare in understanding ICD-10 completely. Now we'll be talking about major code changes and its impact. Diagnosis codes are increased from 14,000 to over 69,000. Hospital procedure codes are increased from 3,800 to over 71,000. The format of code has also changed. That is, the code will now have alphanumeric. The terminology has also been changed. And now due to these changes, more information is needed to code correctly. Also, renovation to processing systems and desktop procedures is required. This means that the systems needs to also be updated in order to implement ICD-10. If we talk about ICD-10 benefits, now with the adoption of ICD-10 CM, stakeholders will have the chance to realize increased specificity in clinical information that can lead to more accurately and timely reimbursements, better quality of patient care, and improved disease and care management. It will provide much better data that will help measuring quality, safety, and effectiveness of care. Clinical, financial, and administrative performance can also be improved. There will be more accurate payments for new procedures. There will be fewer chances of miscoded, rejected, and improper reimbursement claims. By permitting more detailed billing records, ICD-10 would help payers and providers more easily identify patients in need of disease management. It can also prevent and detect healthcare fraud and abuse. And with ICD-10, public health risks can easily be tracked. Now let me ask Babette to go over the impact on reimbursements. Please, Babette.
Well, thank you very much, Kashif. Hi everyone, my name is Ubaid and I'll take you through the impact of ICD-10 implementation on the reimbursement system. So the shift to ICD-10 is likely to have massive implications for the reimbursement system. The ICD-10 version of diagnosis-related grouping would entirely replace the ICD-9 version of diagnosis-related grouping. There would be differences between DRGs in ICD-10 and ICD-9, and these DRG variations, if these are not appropriately accounted for, could result in denied claims. Initial studies indicate negative financial impact of 45%, which may include denied claims, reimbursement errors, and resubmissions, etc. However, so far only medical and surgical DRGs for ICD-10 are available, and there is still a certain degree of uncertainty on the future course of things. It is likely that certain specialties such as cardiology and orthopedics are going to be much more impacted than the others. And it is also to be noted that ICD-10 version of MSDRGs is unlikely to cause a significant redistribution of payment across hospitals. This is due to the fact that implementation of ICD-10 will have no consequences in CPT usage of hospitals for inpatient billing. And now I'll take you through some of the challenges that entail the implementation of ICD-10. And the biggest challenge concerning the shift to ICD-10 is to overcome the perception that this transition is only a coding issue and planning accordingly. However, this planning needs to be done on a much broader and macro level. It should be seen as a business issue which will have widespread consequences for the vendor, provider, and payer, and touch upon key aspects of business like revenue cycle, payer integration, etc. Another key challenge in successful implementation of ICD-10 is that the new coding system's increased specificity would result in much greater documentation to certify each component of the ICD-10 code. One other challenging task is to update all current applications using ICD-9 so that they are compatible with ICD-10 coding framework. Some of these include super bills, charge tickets, contracts, etc. And I think the final and biggest challenge here is that the vendor and provider need to work together in a systematic and coordinated manner to successfully implement ICD-10, and integrated effort is going to be required on behalf of both the vendor and provider. And moving to the next slide, which involves some other challenges facing ICD-10 implementation. The shift to ICD-10 is going to require certain costs associated with development of new systems and staff training and education. Therefore, all parties, including vendors, payers, and providers, need to plan their financials accordingly. And the providers also need to compile a list of all procedures and systems that make use of ICD-9. In addition, all electronic health records need to be updated in accordance with the HIPAA 5010. The upgrade to 5010 is important because the new version will be able to accommodate the forthcoming and mandatory ICD-10 code sets. And finally, a well-structured timeline needs to be established on part of both the vendor and provider to ensure smooth claim processing with minimum denials and bottlenecks once the deadline is due. And now we'll move on to the next chapter, which is the impact of ICD-10 implementation and coding and documentation. We'll start off with a very quick overview on the coding framework of ICD-10. The code entails a 3 to 7 characters alphanumeric code. The first 3 characters correspond to the category of disease. The 4th character corresponds to the etiology of disease. The 5th character defines the body parts affected. The 6th character is linked to the severity of illness. And finally, the 7th character is a placeholder for extension of the code to increase specificity. And it is hoped and expected that the additional details in the new coding framework would result in improved coding specificity and complete and clearer instructional notes. And on the next slide, we'll go through the clinical documentation and we'll study some cases. Well, specific information must be documented in order to select the most appropriate ICD-10 code. The code pattern would vary from one diagnosis group to the other diagnosis group. However, it would be consistent within one particular diagnosis group. Consider the example below, diabetes mellitus. Some of the information that needs to be incorporated into the code includes the type of diabetes, body systems affected, complications or manifestation, and if type 2 diabetes, long-term insulin use. Now consider the other diagnosis group, which is the case of a fracture. Well, in this case, the code needs to document the site of the fracture as well as laterality, which, for example, refers to that whether the fracture is on the left arm, right arm, or both arms, and the type of the fracture as well as the location of the fracture. And in the next slide, we'll have one more example to further elaborate on this. Consider the case of fracture of tibia. The corresponding ICD-9 code is 733.93. However, in the new ICD-10 coding framework, there are 12 possible entries for this disease, depending on the nature and scope of disease. For example, M84.362A corresponds to the stress fracture left tibia initial encounter for fracture. In scenarios such as these, the last alphabet represents the stage of the encounter. If the code indicates an alphabet other than A, then this corresponds to subsequent encounters. Now I will pass it back to Kashif to go through accounts receivable.
Thanks, Ubaid. Now, in terms of accounts receivable, the ICD impact on accounts receivable would be it is expected that the average time from billing to reimbursement may increase or may decrease. And also in terms of denials, there may be certain coding errors from the provider's end and plus certain errors that will be from the payer's end as well. It is also expected that there will be some requests for information and resubmissions of the claims again from the payer's end. We'll also talk about the misconceptions, and basically ICD-10 will not really happen. It is basically perceived that, again, ICD-10 will really not happen because last time the due date was this year, but that has been extended. So again, providers believe that the delay will again happen, or they still have to wait till ICD-11 comes up. In terms of a vendor, billing agency, and clearinghouse, it is believed that they will take care of ICD-10 for providers, but in return, the providers also have to show their interest in order to learn and understand ICD-10 usage. In terms of hard copy claims, it's still believed that they will also be billed with ICD-9, but that's not the case. They also have to switch to ICD-10. Either they are going electronically or if they are submitting the hard copy claims. Now, if we talk about the perceptions, it is believed that maybe by implementing ICD-10, there will be a lot of coding issues, ID issues, complying issues, and so on, and it will basically be creating a problem for the providers as well as for the vendors. In case, if we look at the bigger picture, we will see that it is basically given an opportunity, a path for providers, payers, and vendors to come together and to work in terms of, for a better business opportunity. I will now have Ubaid to go through the important dates and timelines.
Right. So this is MTBC's proposed timeline for successful and smooth transition into ICD-10. We recommend that by the mid of 2013, practices should have set up management team and coordination manager and started an impact assessment to identify potential changes to workflow and business processes. During the later months of 2013, providers should be completing their system design and development plans. Staff should receive initial education about the changes ICD-10 will bring to the workflows, and the internal testing of test claims should have begun. And by the fall of 2014, training and external testing should be completed. All transactions must be conducted using ICD-10 codes beginning on the 1st of October 2014. Failure to use ICD-10 codes for services provided on or after October the 1st will result in denied claims. And now in this regard, MTBC has made considerable progress in terms of both system design and staff education in order to comply with ICD-10 requirements. Here at MTBC, we have developed a translator tool for ICD-9 to ICD-10 mappings. The tool is based on general equivalence mappings and is available on our website at www.mtbc.com. In addition, we've also upgraded EDI front-end design to comply with ICD-10 standards. Moreover, we are currently in the process of enrolling providers for beta testing. And the message that goes out to our partners is that they should start impact assessment right now, because the sooner the better, and strong training will be necessary for all staff, including physicians, given the scale of changes that will be coming up ahead. And MTBC will offer information and support, but we're not an ICD-10 training resource. Going forward, we will be conducting intense and continuous assessment of provider partner readiness through outreach and engagement programs such as this webinar, which shall serve as a platform for provider-vendor interactions. Our provider beta testing strategy involves the following steps. Number one, who wants to test? Whoever would like to stay abreast on all major developments and be part of a successful implementation of ICD-10 systems. Number two, when will they be ready? This is at the discretion of the provider, but we recommend the sooner the better. Number three, what do we test? MTBC will be testing ICD-10 test claims as soon as we receive instructions from MDON, which is our major clearinghouse regarding claim testing. Number four, how do we test? MTBC will be testing in coordination with our clearinghouses, and further details relevant to this will be released in the upcoming seminars. Now back to Kashif.
Thank you, Ubaid. And if we talk about MTBC's ICD-10 tools and resources, there's MTBC Provider Resource Center that has been established, and that will basically be providing the information and resources, and will try to help our providers. If there is any question or suggestion in regards to ICD-10, you can throw us an email at icd10@mtbc.com. I repeat, that is icd10@mtbc.com, and we will try to help our providers if they have any questions or any suggestions. We also have our website, that is mtbc.com. Anyone can visit the website and can find out tools, resources in terms of ICD-10. There will be some other links available. There will also be certain scenarios-based challenges that will further explain ICD-10 and its implementation. In terms of webinars, MTBC will be conducting monthly ICD-10 webinars, normally from 1 till 2 p.m. Eastern Standard Time. And in the future, we will be trying to cover the readiness checklist, what does assessment and implementation mean, the coding scenarios, and we will also be bringing in guest speakers who will basically share their perspectives. Apart from these, if any provider would like to, or any participant would like to send any suggestions for any other topics that needs to be discussed, you can send us an email at icd10@mtbc.com. Apart from MTBC, we also have tried to gather some information in terms of external or the basic source of ICD-10. You can either go to CMS website, that is www.cms.gov, or you can go to www.ready.org, and also another important website is www.icd10watch.com. So you can get some other information in terms of ICD tools and some of the resources. Once again, if you have any questions or comments, you can send the email at icd10@mtbc.com. A copy of this webinar will also be available on our website, that is mtbc.com/webinars.aspx. Anyone who wishes to go through this webinar again, they can log on to the website in order to see the video available. Since we are at the end of this webinar, we will just take a moment in order to retrieve the questions, and we will see whatever questions we have received, and then we will try to answer as many as we can. So we will just take a little moment, and we'll be back. Thank you. All right, thank you, everyone. And we have received some questions. So the first one is that, will MTBC update the super bills to support ICD-10 codes? And would there be any cost for that update? Well, yes, MTBC is already working on it, and it is progressing in terms of the conversion from ICD-9 codes to ICD-10 codes on the super bills. A new and improved feature will be the creation of dynamic super bills, which will be more flexible in incorporating the new coding procedures. The clients will be able to test the new dynamic super bills starting in the third quarter of 2013. And the important thing is that there will be no cost associated with the testing. All right, so we will try to retrieve more questions. And yes, another question is that what MTBC resources are available for testing ICD-10 claims? Or in other words, that when can the providers begin sending ICD-10 claims to the various payers? In this regards, MTBC plans to initiate testing ICD-10 claims as soon as the clearinghouses are ready to commence processing ICD-10 claims. The majority of vendors and clearinghouses, including MDON and Medicare, are starting external testing that are going to begin in October 2013. Therefore, MTBC will start testing ICD-10 claims to the various payers starting in the fourth quarter of 2013. All right, so we are trying to get more questions.
Right, so we have another question here, which is that what are expected costs involved with ICD-10 transition? Well, to answer that question, there will be no cost to MTBC clients with respect to the ICD-10 transition. MTBC will be updating the practice management and EHR solutions, so they're fully compatible with the ICD-10 diagnosis codes. This will have no impact on the contractual agreements between MTBC and its clients. Moreover, the ICD-10 transition will not interrupt MTBC clients' cash flows and clinical workflows. I hope this will suffice, and if there are any confusions, please post them. We'll retrieve for more questions if there are any.
Okay, yes. There's another question that is how MTBC will commit to reviewing and troubleshooting the claims post ICD-10 implementations. Well, MTBC is fully committed to ensure the claims revenue cycle of our clients is not affected by the ICD-10 transition. We at MTBC are in constant communication with MDON, that is our claims clearinghouse, to make the transition process error-free for our clients. Additionally, MTBC support staff will be available 24/7 to answer your queries, any technical issues that you will be facing. They will be providing support, or any other educational resource will also be provided.
Well, thank you very much for your participation, everyone, and we look forward to your attendance in our upcoming webinars as well. And MTBC is fully committed to making the ICD-10 transition hassle-free and smooth for all our clients. We will be fully ready to process ICD-10 claims by October 1st, 2014, and this brings the end of our webinar, and good luck with ICD-10, everyone.
All right, once again, we thank you for attending this webinar, and it's time to say goodbye. Thank you very much, and have a good day. Goodbye.